News at LAX, where health officials just announced they will begin screening passengers for a newly identified coronavirus. Officials say the screenings will be for those arriving from central China. The new virus has made dozens of people sick, killed 2 people. LAX, along with JFK and the San Francisco International Airport, will conduct these screenings for the next couple of weeks.
Now, Thailand, though, has confirmed a second case of the mysterious coronavirus that first appeared in China's Wuhan city last month. This comes as it steps up checks on visitors arriving from China. Officers say there's no official outbreak, or there's no outbreak in Thailand, and they're very confident of controlling the situation. Saksitha Sombat with more.
According to a statement by Thailand's Public Health Ministry, the second patient is a 74-year-old woman from Wuhan in China, and she has been detected on January 13th at Bangkok Suvarnabhumi Airport with very high fever, 38 degrees Celsius, and pneumonia-like symptoms. But she has been put under isolation, but she's already responding well to the treatment, according to the health officials here. Now, this comes after the first case that has been reported earlier this week in Thailand, which is also the first case of the Wuhan coronavirus outside of China. Similar circumstances as well. It is also an elderly Chinese woman here as well, 61 years old to be precise, but she is already well reportedly, and it's just a matter of time until she's ready to go home already. Now, obviously, with the Chinese New Year just around the corner, Thai health officials remain on high alert. In the first 2 weeks of this year, they have already checked 86 flights from Wuhan in China, all in total a number of 13,624 passengers. They have found 21 suspected cases, but they only turned out to be the seasonal flu. 12 of these people have been already discharged. Tourism remains a vital economic factor here in Thailand, even though arrival numbers have slightly flatlined in the past year. Nevertheless, it is expected that hundreds of thousands of Chinese tourists come here to Thailand for the Chinese New Year, and that's why the Thai health officials have ramped up health monitoring, health checks at several major airports here in Thailand. They include Bangkok's Don Mueang and Suvarnabhumi Airport. They include Chiang Mai in the north of Thailand, as well as Phuket and Krabi in the south. Now, the Public Health Minister Anutin Charnvirakul, he said that there is no outbreak here in Thailand, and he also says the fact that they have found these patients with the Wuhan coronavirus is proof that the system they have put in place here is indeed working. Saksitha Sombat, CNA, Bangkok.
Reports of patients suffering from a mysterious illness in Wuhan emerged at the end of December. The outbreak was linked to a seafood market in the city. But even after the market was shut on January 1st, new cases of the virus appeared. More than 40 cases have now been diagnosed in Wuhan. On January 9th, Chinese health authorities said they'd identified the cause of the outbreak, a new coronavirus from the same family as SARS. 2 days later, the first death was reported. A second death was confirmed early today, and earlier this week, the first case outside of China was reported in Thailand, followed yesterday by another in Japan. Experts are still trying to understand how the virus spreads. Officials say the risk of human-to-human transmission is low, but possible.
The World Health Organization has warned that there's potential for the Wuhan coronavirus to spread. This comes a day after Thailand reported the first case of the illness outside of China.
The WHO says human transmission has been mainly contained to small clusters in families, but there is potential for a wider spread. The agency has given hospitals worldwide guidance about infection control in case of the virus spreading further.
Health alert for airline passengers arriving from central China. Travelers who had direct or connecting flights from Wuhan, China, must have additional health screenings because of the coronavirus outbreak. Passengers are being screened for symptoms at 3 U.S. international airports, JFK, Los Angeles, and San Francisco. CDC says 100 additional staff has been added to the 3 airports. Health officials say the risk for exposure to the coronavirus is considered low.
3 U.S. airports to screen passengers for Chinese coronavirus. Passengers from Wuhan, China, will be screened at JFK beginning Friday night, and in San Francisco and Los Angeles starting Saturday. Airports in New York, San Francisco and Los Angeles will begin screening passengers arriving from Wuhan, China, for infection with the mysterious respiratory virus that has killed 2 people and sickened at least 45 overseas. The Centers for Disease Control and Prevention announced on Friday. Most people with the disease are believed to have contracted it from exposure to animals at a market that sells seafood and meat in Wuhan, and it is not certain that the virus spreads from person to person. But a few cases have not been linked to animals, and researchers say some human-to-human transmission may be possible, so precautions are necessary. About 100 experts from the CDC are being deployed to the 3 airports. The first flight to be screened will arrive at New York's John F. Kennedy Airport on Friday night. Dr. Martin Citron, director of the CDC's Division of Global Migration and Quarantine, said at a news briefing. JFK is the only airport in New York where the screening will take place. Screening at San Francisco International and Los Angeles International will begin on Saturday. Over the next few weeks, some 5,000 passengers are likely to be screened, Dr. Citron said. From 60,000 to 65,000 people a year travel from Wuhan to the United States. Only New York and San Francisco receive direct flights from Wuhan. Those passengers arriving in Los Angeles are on connecting flights. I think it's highly plausible there will be a case in the United States, said Dr. Nancy Messonnier, director of the National Center for Immunization and Respiratory Diseases in Atlanta. Travelers will be asked to fill out questionnaires asking if they have symptoms like cough or fever, and whether they have visited meat or seafood markets in Wuhan, the epicenter of the outbreak. Screeners will also use thermal scanners that can be pointed at the forehead or temple to look for fever. People with signs of the illness will be examined further, and those who seem likely to be infected will be sent on to area hospitals for further testing. Dr. Citron declined to say which hospitals they would be sent to. The illness was first reported in late December in Wuhan, in central China. Fears of a more widespread outbreak arose this week when 2 cases were found in Thailand and 1 in Japan, apparently carried to those countries by air travelers from Wuhan. Like the Science Times page on Facebook,